Good day everyone, I am patient Lepo from BSN 12E and I'm going to perform Leopold's maneuver. Leopold's maneuver is used to systematically palpate the gravid uterus. It is an easy to perform non-invasive method to determine the position, presentation, and engagement of the fetus inside the uterus. This is also done after 36 weeks gestation to help the expectant mother and the healthcare provider be better prepared for labor, and it also helps in determining if it's much safer to perform cesarean section. Prior to the conduct of the procedure, I have prepared the necessary equipment that I need. It includes the pillow, towel, and the stethoscope. Wash his hands to protect my patient and myself from infection and cross-contamination. So, good morning, ma'am. I am patient member, your student first for today. And may I see your wristband, please? Please state your complete name and birthday, please. Okay. Explain the procedure to the patient so that the patient will know what will be conducted to them. So today, ma'am, we'll be doing the Leopold's maneuver. It is an easy method which we use to determine the position of your baby inside your uterus. So later, what I'm going to do is to feel your abdomen I'll, and put a little pressure so that I can feel and determine the position of your baby. Let the patient empty her bladder before the procedure. An empty bladder promotes comfort and allows for a more productive examination. Okay, ma'am, before we begin the procedure, I encourage you to void first so that later you won't feel uncomfortable. So, okay, are you done now? Position the patient on the supine with the one pillow under her head and with the knees slightly flexed. This would relieve the tension in the abdominal musculature, and placing a towel beneath the patient's hip will displace the uterus of the inferior vena cava and the aorta, thus preventing spine hypotensive syndrome. Okay, ma'am, I need you to lay down. Okay, and slightly flex your knee and turn around so that I can put this towel underneath your hip. Okay. So now I'll begin, but first I need to expose your abdomen, ma'am. If right-handed, stand at the woman's right facing the patient. This is the proper and comfortable position while doing the assessment. And now I'm going to proceed with the first maneuver, which is called the fundal grip. Faces the patient and palpates the uterine fundus to determine what part of the fetus lies in the upper part of the uterus. To be able to know what part of the fetus lies in the upper part of the uterus, it may be in the fetal head or the bridge of the fetal head feels round, hard, freely movable, and bloatable, while rich feels softer and noodler. Now I'm going to proceed with the second maneuver, which is called the umbilical grip. Palpates in a downward direction in the side of the abdomen, applying gentle but deep pressure to determine the position of the fetal extremities, the fetal back, and the anterior shoulder. This is to determine the position of the fetal extremities, the fetal back, and the anterior shoulder. Okay, now what I will do to palpate your downward lateral uterine surface and determine the fetal back or fetal extremities. And I'm going to deep but apply gentle but deep pressure. So now I'm going to perform it. I'm going to proceed with the third maneuver, which is called Pollock's grip. Places one hand over the symphysis pubis and grabs the lower uterine segment between the thumb and the fingers to feel the presenting part. It permits determination of the location of the presenting part in respect to the true pelvis. So now I'm going to place my hand over the symphysis pubis, grabs the lower uterine segment with the thumb and finger and determine if the ligament has already occurred. So now I'm going to proceed to the fourth maneuver, which is called the pelvic grip. Turns the faces to the woman's feet to confirm the finger of the third maneuver and determine the flexion of the vertex. This is done to determine the findings of the third maneuver and as well as to determine the presenting part that is in the hypogastrium of the mother and determine the salatic prominence. So, if the prominence is at the same side of the fetal extremities, then the head is flexed, but if its prominence is of the same side as of the back, then the head is extended. Locates again for the back of the fetus and places a stethoscope over and listens for the fetal heart tone for 1 full minute. This is to know if there are some presence of some abnormalities in the baby's heartbeat. So now we are all done with the maneuvers. We are now going to locate the fetal back again and listen for the fetal heart tone. Notes the location, rate, and character of the FHT. This is to proceed for hearing the heartbeat of the baby, but first you need to locate it. Locate the fetal heart tone and listen for 1 minute. And I've already done it. Then next is makes the patient comfortable so that the patient will be free from any stress and have better health. Okay, ma'am, I'm going to cover you up again. So, are you comfortable right now? Okay. Documents the observation made, the fetal presentation, position, attitude, and whether engaged or floating, so that the patient will know what are the results in the assessment if there is any problem to her or not. So after doing the procedure, I have determined that your baby at your right side, and that means your baby is in the cephalic position, which means that the head of the baby is at the lower part of your uterus, and it's already engaged, ma'am. This is an ideal position for the baby for the labor. Also, when I was listening for your baby's heart using the stethoscope, I have counted it and it's in 125 beats per minute. And that is normal and good, ma'am. After doing the procedure, proceed to perform hand washing and the documentation of the findings.